Hi everyone. So I'm joined today by Sebastian Hicks, who's an osteopath and has been in the industry for over 10 years. And why I'm really excited to talk to him today is because not only are you just an osteopath, but you've got such an extensive background in rehab, which I find really fascinating. So welcome.
Thank you, Sylvan. It's good to be here, and thank you for the invitation.
Yeah, and it's just nice to be able to see you, especially given everything that's going on. And it's just
Absolutely, yeah. It's been very strange times, isn't it, for the healthcare profession as a whole? And so it's really important that we try and connect and stay connected and get information out in the open. And Zoom is a great way to do that. So.
absolutely. How has it changed for you, given like social distancing and lockdown at the moment, in terms of your
So
practice?
yeah, I mean, the way that I practice is obviously as an osteopath we use our hands a lot, so it's very much hands-on treatments. So the way the lockdown has influenced work is that it's gone very much more online now. So having to adapt to that way of working has been a challenge, but enjoyable. It's very different to a very different way of working. But I think it's opened a lot of osteopaths' eyes in terms of what can be done online and the advice and the input that can be provided to patients. When the clinic doors are closed for safety reasons, as they have been for the last few months. So yeah, it's certainly opened up new doors and given us a new insight in terms of how we can work.
Yeah, and do you think it's changed how you think you'll work after sort of things go back to whatever normal?
I think it's important to keep a balance. So I don't think I'll take all the practice online or anything like that. But I think the way that perhaps communication with patients is held after sessions, and perhaps wellness packages or healthcare packages and the way they're implemented could be a way forward for sure. But I definitely think it's important to keep a balance and strike a balance between seeing people face to face and obviously the online stuff.
Yeah, because as you said, like a lot of what we do is still hands-on. And I've really struggled being able to not put my hands on a patient and do sort of like a passive uh, intervention for them. So for me, it's been sort of more sort of active in terms of just delivering information and educating patients rather than doing things for them in a way.
Absolutely, yeah. And it really does hone on your communication skills as well. You've got to put things perhaps in a direct, more simplistic way if it's over the phone or online. The demonstrations have to be really precise and things. So it's definitely a challenge, but I found it enjoyable.
Yeah, have you found patients of yours been receptive to it?
Absolutely. The patients that I've seen, they've really responded well, especially the patients that have required a bit more movement intervention. So doing the new patient osteopathic consultations is a bit more of a challenge in terms of what you can provide, obviously, or can't provide. But the patients where we're able to provide a little bit more movement advice and take patients through active movements, it's been really productive for sure.
Yeah. And I want to go back to your sort of movement based practice because I mean, I know you, we know each other from having worked at a studio in Baker Street together
Yeah,
a while ago now.
a long time ago.
Yeah, a long time ago. But part of what I remember watching you work and part of what you do really well is you get patients moving in ways that are sort of cohesive to their treatment plan and just in ways that they don't think they can in a way. And that's what I really appreciated about watching you work.
I think the couch-based interventions is absolutely got a place, and I think it's really important for some patients to apply that form of treatment. But I think when possible, it's really important to educate patients about the need to get up and get off the couch and start to learn how to use their new joint range of motion, or to use the kind of body that we've provided for them, so they don't fall back into old patterns. And I think applying articulation and soft tissue techniques and various osteopathic techniques off the couch, can have a really beneficial impact on patient outcomes.
Yeah, because obviously as a new graduate, we're taught mainly couch-based interventions. So
Yeah.
why do you, I mean, I suppose it's a question for everyone, but why do you think sort of traditional osteopathic sort of education, at least at university, is so
Yeah.
couch-based instead of, it is movement-based, but it's primarily couch-based.
Yeah, it's a passive intervention. It's generally people lying, and receiving a passive intervention on a joint, which absolutely has its benefits. Don't get me wrong, but I just think the history of the osteopathic profession and the way it's progressed over time has been very much down that avenue. But I think now with the kind of increase in awareness and the importance of movement and wellness and exercise, especially during this lockdown period, people are understanding how even small movement interventions can have a positive impact on how they feel, not just physically but emotionally and mentally as well.
Yeah.
So I think we have a duty as osteopaths to educate patients, not just with couch-based interventions and advice, but also to help provide lifestyle and exercise and nutrition advice as well. I think they all combine really closely.
And so how much of your background do you think has influenced that? Because I know you have an extensive rehab background.
Yeah, massive. So I think, obviously coming from a fitness industry, my bias is naturally towards getting people up and moving. So that's been a real advantage. And I think, it's definitely held me in good stead moving into osteopathy and doing more passive interventions for sure. So it's definitely the ethos and the approach that I like to take with patients is to try and get them when possible and when it's appropriate, educating them in through exercise and active mobility and active strengthening and active movement interventions. So there are obviously times when that's not, appropriate, but each patient to their own, and we've got to understand the needs for each person we see.
Yeah, because what had you done prior to becoming an osteopath?
So my background was in fitness and rehabilitation. So at Middlesex, they did a really, really good course that provided a foundation in understanding how people move through rehabilitation from sports injuries back to full function. So it was really understanding how osteopathy could work alongside rehab and exercise and movement. And the link is well massive. It's really, really important. And yeah, they work really well. So if you look at the elements of fitness and rehab, strength and power and flexibility and balance, all these elements come together to provide a good foundation for movement. And osteopathy works really, really well alongside those elements. I think there's a really, really, really big link.
So did you know you wanted to go into osteopathy following the rehab degree you did, or was it something that
seemed a natural progression? Yeah, it seemed a natural progression. So I kind of looked into different options and going further down the fitness industry, and I like using my hands to treat patients. I think there's a real benefit for using therapeutic touch, osteopathy seemed like a natural progression, moving on from rehab and fitness.
Yeah, because one thing that I noticed, especially going, having, like I said, having just qualified, was that we touch upon rehab at school, at university, but it's and this is no criticism because it is what it is, but it's not extensive enough, for example, in comparison to physiotherapists that I've been working alongside now. Yeah. So one thing I felt coming out of it was that I didn't know enough practically in terms of rehabilitation or getting people progressively moving through a series of exercises away even sometimes start from. And it was almost me sort of like finding my way as I went along. Why do you think we've not really caught up on that side of things in terms of the education bit? I
think rehab is such a massive topic, isn't it? I mean, you can go, to PhD level and master's level with this. So trying to implement, one or two modules into a training course, which is already, you and I know, is massively intense and very, very challenging. It can often create, I think, confusion, because some people who've perhaps gone into osteopathic education who don't have that fitness and movement background, it can create this, dilemma in terms of, opening a can of worms slightly without knowing that full, the full impact of what it can do, and exercise advice, if it's done incorrectly or provided in the wrong way, can be dangerous. And I think, opening that can of worms is a potential, risk and challenge to the osteopathic profession, because especially on these courses and these educational programs, because there is such a massive load of information to absorb and to take in. So it's definitely got its benefits, but how to integrate that is I think is a very difficult question, but it's something that I think certainly needs to be addressed and looked at.
Yeah, absolutely. Because obviously my background is in Pilates, so everything I did was Pilates based. If you ask me to do any strength training with a patient, I have no idea where to go or where to start with that.
Yeah.
So when it comes to
sorry. I think with osteopathy as well, because of the different branches of the profession, there's the cranial approach to osteopathy, and then there's the more MSK and structural approach, and then the visceral approach. So people will go and see an osteopath, and they expect a certain, intervention or treatment. And so I think there's that difficulty comes into play as well in terms of, osteopathy as a general term, and then its subdivisions in terms of people who specialise in more the cranial approach, who aren't going to go and provide, rehab and exercise input perhaps as much as a structural or an MSK osteo. So, they're the kind of challenges as well in terms of how to integrate that into a foundational course or program.
Yeah, and so when a patient sort of looks you up or books in a treatment, how are you able to sort of manage their expectations in terms of what they're looking for versus what you do and your approach?
So I'll just be very upfront with them and say, if they're looking for an approach that's more visceral, I'd be completely upfront and say, look, this is the work that we do is going to impact the viscera massively, but it's perhaps not the traditional visceral osteopathic approach that they're after. So it's just being upfront and honest with the patient and saying, the approach that I work is very much more about active movement and trying to get people away from passive interventions excessively. And if they're on board with that program and that platform, then we move through. But it's explaining how the work that I do is very much it impacts a lot of the other systems and the other approaches massively, but it's perhaps not focused so much on one approach or one method. It's a bit more integrated. So that's how I'd explain it to patients.
Yeah. And so what are the sort of the ethos behind your treatments and the things that you try and integrate? What kind of things are you trying to integrate? I know it's so subjective to an individual, to a patient in front of you, but.
Yeah, so obviously it depends on, like you say, it depends on who you see and what their goals are, but it's, I think education is a really, really key thing as well in terms of trying to teach patients and educate patients about what they require. So I don't want to be the kind of osteopath that just stands and preaches and tells people, what they should and shouldn't be doing. It's about educating them to take control of their body and their, how they look after themselves and their health. So part of that is obviously looking at, limitations in joint restrictions, strength deficits. So a simple way that I would put this together for an aspiring osteopath would be 3 simple words. So gather, organize, and initiate. So, the first thing when I see a patient is all about gathering information. Now that information can be relevant to their musculoskeletal history and their medical history, but it's also beyond that as well. It's understanding about their psychological health, any social issues in their life, any financial problems. All these things come into play to kind of create a bigger picture in terms of how you can help. So once you've got this information, the next element in terms of how I look at an assessment is to organise the information that I've got into understanding, is this patient looking for more of an active approach or more of a passive intervention? So with the information that I've provided, are they going to benefit more from couch-based work, or are they going to benefit more from me getting them doing some exercise and movements? And then once we've got the kind of organized data together, so to speak, of their assessment, you can then implement that. And that implementation comes in the form of education. It comes in the form of exercise advice, nutrition, which is another huge topic, which we probably won't cover much today. So that's kind of how I would, really simple way of looking at it, rather than getting, drawn into, the intricacies a lot of the time. And we don't look at the bigger picture.
Yeah.
So, that's kind of how I would look at assessment, really.
Yeah. And that really puts it into sort of a way that you can sort of digest easily, rather than
Absolutely.
thinking of every single kind of differential and how to test for it and how that links into a systemic issue and
Absolutely. Yeah. So another simple way is someone comes in and the first thing I do is I look for elephant or mice. So it sounds a bit odd, but let me explain.
Okay.
So someone comes in the door, the elephants are the sway back posture, the anterior head carriage, the rotated shoulders inwards, the arches dropping. These are the obvious discrepancies, postural discrepancies that you see. So, they're the major things that I'm observing with this patient. The mice, however, these are the kind of smaller, perhaps less obvious signs that you're seeing with a patient in terms of their presentation. So perhaps is there something underlying beyond the musculoskeletal compensation that you've got to address? Is it, perhaps a small torsion in the thorax that's that you can see? So is it something less obvious to the eye? And by looking at those, by kind of splitting an assessment up into the elephant or the mice, I think it gives you, just a different platform on how to work as well. So that's another approach that I often take.
Yeah, I've never heard anyone explain something like that before in that way. So that's really interesting.
Yeah, just the elephant or the mice. So it's it works for me. It's something that I've used over the years, and because in osteopathy we're often taught to look at the structure as the absolute goldmine. And absolutely, it's super important. But perhaps if we look at why that elephant is presented like this, with that anterior head carriage and that major sway back and the posture that's held like this, perhaps there's something behind that as to why they've presented like that in their life. And it's important to try and gather information from the patient as a whole, rather than just going, right, let's work into the pecs, or let's try and work into the thoracic spine to get the T-spine moving a little bit more. So it's important to understand why perhaps people present in a way that that creates an altered structure.
Yeah,
not just treat the altered structure.
Yeah, because that goes beyond that superficial layer of what presents in front of you to understanding the whys.
Absolutely. And it's and it will put the patient at ease as well. I mean, I think it's about finding rapport and establishing that relationship with the patient. And if you just go in and treat the patient for what they see with the kind of structure that's put in front of you, I think that's for some patients that's what they want. Some patient come in and they've gone for a run and they've done their ankle in, and they want an intervention for the ankle, and they're not interested in anything beyond that. And it's important that I think we understand and we try and manage the treatment protocols depending on who comes through the door.
Yeah,
I think the elephant and mice is a tool that's worked for me anyway.
Yeah, where did that come from? Is that something you just developed? Or?
Yeah, it's just something that I remember our principal at college, and he was an amazing practitioner. He's no longer with us now, but I learned so much from him. And I remember him doing a standing exam on a colleague, and he was demonstrating the extremes of kind of a massively poor posture, if you want to call it that. And these things just popped into my head in terms of what I could call this when patients come into the room. And then we had another colleague who had a much smaller postural discrepancy, so to speak. And then I tried to just associate those two extremes with something that would work for me. And and that does, and it's just been quite a valuable tool in practice.
Yeah.
But
And was
certainly
this,
looking beyond the structure.
yeah, and was this at the LSO?
Yeah, this is at the LSO, so it was a
Yeah.
great training institution. So yeah, it was fantastic, really good.
Yeah. Because from my research, when I was looking into going to osteopathy, they were one of the few places that actually did the part-time course.
Yeah, that's right. They were great because the part-time training allows you to kind of apply and kind of learn your, you know, skills as you go, really. So, you know, especially in the industry that myself and a few of the colleagues on the course were in. So we were lucky that we could apply that information, you know, back into the gym world and the gym environment. So looking at, you know, when we were learning about the lymphatic system, understanding how the lymphatic system works when you've got someone doing cardiovascular exercise, understanding, you know, not just looking at anatomy on a board, understanding how, you know, the quads work and the pelvis torsions through running. So, you know, understanding the anatomy in an applied fashion was a real advantage, I think.
Yeah. And would you, obviously I did the full-time course, which is, you know, equally were both just as intense.
Yeah, absolutely.
But so you were obviously studying and working alongside that full time.
Yeah, yeah. So I was working in the gym and doing training and rehab, and then working in the clinic environment, and the lectures were at weekends. So it was a full-on few years.
When do you sleep?
Just whenever. Usually looking in anatomy books sent you off to sleep sometimes. So
No
yeah,
idea what you're talking about.
yeah, never. But you know, I think I'm sick of pathology and anatomy books. So, but slowly having to dig them out again.
Grey's Anatomy is embedded under my pillow.
As it should be, Sil. As it should be. As it should
Hopefully,
be.
hopefully trying to absorb it via like osmosis or something because it never
Yeah.
went in otherwise.
No, exactly. Well, you know, step by step, it's all a learning process, isn't it? So.
Yeah. So in terms of the types of patients that you see, do you have a typical patient or a common presentation that you see often?
So I think when I started in the profession, we saw a lot more acute patients. It was a lot more. There were a lot more structural based presentations. So you know the acute lower back, the rotator cuff problem, the ankle sprain. But I think over the last couple of years, we've really seen a transition away from the more acute setting into more of a chronic pain presentation. So, you know, I'm sure you've had this as well. So when your patients come in and they go, well, I've been to my doctor, I've had some blood tests have come back negative. You know, I've had this gut problem and I'm feeling a little bit sort of brain fog. You know, I've had this headache for the last couple of weeks, and you know, my joints just feel a bit stiff and a bit achy. But everybody and the doctors and the scans that I've had in the medical profession, that they've shown, you know, there's no problem. So that's been a real challenge, is seeing those kind of patients come through the door. But it's really, you know, it teaches you to try and adapt and try and learn a new way of thinking and a new way of managing patients. So the biggest transition is certainly from more of the acute setting to more chronic pain, for sure.
And what kind of sort of treatment modalities have you started including over the last few years, or CPD that you found really helpful in terms of implementing into your own practice over the last few years?
So nutrition is certainly one facet and one element that I've really started to look a little bit more into. You know, it's a massively important and huge subject. And I think, you know, the role of nutrition, not just on the digestive system, but it's understanding the role of the digestive system on the musculoskeletal system. And that's where I think the relevance of nutritional education comes into play. And, you know, I've been doing a few courses in the field of functional health and functional medicine now, which is you know, I'm sure a few of your listeners have heard and become familiar of those phrases and those topics now. And the microbiome is another word that's, you know, been in the research and the literature a lot recently. So understanding how gut function impacts upon not just, you know, the digestive tract and the digestive system, but also can create problems in relation to systemic or low-grade inflammation in the body is massively relevant, because that can impact how someone heals from a musculoskeletal injury. So if you've got a knee synovitis, for example, then doing all of the osteopathic or physio or musculoskeletal interventions might take you so far. But if there's something underlying in that patient's body, which is causing a low-grade level of inflammation in their blood, then you're going to get a limited response in terms of the musculoskeletal impact that you can provide. So looking at low-grade inflammation is hugely important, I think, now. And not just that, it's looking at how that impacts upon mental health and anxiety and depression. So understanding not just how dysbiosis or altered gut microbiota can impact or influence the musculoskeletal system, but also impact upon how a patient feels and how they feel emotionally. So all of these things have to come into play to understand how you treat and how you manage a patient that comes through the door, and it's understanding and unraveling their story, really, which is really where things become more pertinent and more relevant, I think.
Yeah. And one thing that I know, that having watched you work, is that you make it look rather easy, because all these things are obviously.
I don't know about that, Sil. I don't know about that.
Well, all these things are sort of like permeating through your thinking and your interventions, while someone's just sat there and they're thinking, okay, cool, you're just moving my ankle around, if I've got a running injury, for example, but actually you're thinking about the connection between sort of all these other things and how that influences how somebody will present and what intervention they might respond to best.
Absolutely. And, I think a prime example of that is the lymphatic system, it's a mechanical pump. It doesn't function in the same way that the circulatory system or the cardiovascular system functions, in that it's an autonomic process. We don't have to get up in the morning and press an alarm to get our heart to start working. So most of the, thankfully for a long time. So, working through the lymphatic system is a really interesting way of looking at the body, especially when we apply manual therapy techniques. And I find that particularly interesting.
Yeah. Have you heard of Perry Nicholson?
Perry Nicholson, yeah, rings a bell.
Yeah, so he's huge on sort of like social media and Instagram and things like that, and his focus is very much on the lymphatic system. And so having read his posts and sort of going to his website and things like that, like he talks a lot about the lymphatic system and how it can permeate into all your other systems, because it is so intricate. I mean, it's pretty much your circulatory system in a way.
Absolutely.
So, yeah, I get flashbacks of other things and of what other people have said, and I'm like, oh, this makes so much sense. Why have I not read more about this?
Yeah, absolutely. And it's that, like you say, it's the links to the other system. And I think the other thing that we could probably add into that as well is the impact on, we've talked a lot about the importance of movement and active therapy, but the role of passive therapy in reducing inflammation in the blood is a growing topic of research now.
What do you mean by that?
Reducing the levels of pro-inflammatory cytokines, which have been shown, if they're present in the body for a long period of time, can be detrimental to health. And passive physical therapy has been shown to have a really positive impact on reducing the level and the biomarkers of pro-inflammation, which is a really powerful field of research which is developing now.
I want to take a second. That's huge.
It's very significant. Yeah. So it's understanding how, because we talked a lot about inflammation is a good thing. It's a natural response. If you fall over and twist your ankle, you're going to hope that everything swells up, becomes red, painful, and tender to touch. That's a completely thumbs up. That's what we want. Right? That's a protective mechanism. But if we add into these injuries have a healing cycle, and if that healing cycle is kind of not is not adhered to, so to speak, and other facets in that patient's life contribute to stress and elevate levels of cortisol in their body, then what can happen is that acute injury, that perceivably simple rehab, or not simple, but that perceivable rehab response can be delayed and promote levels of pro-inflammation or pro-inflammatory biomarkers in the blood. And passive osteopathic techniques or physical therapy techniques have been shown in studies to date to start to reduce and lower those pro-inflammatory biomarkers, which have been, shown to have, a wide range of hazardous health consequences.
Yeah, and that's further evidence of what we do makes a huge impact.
Massive.
Because there isn't a lot, especially I'm comparing it, of course, to physiotherapy modalities, but there isn't a lot of research in the osteopathic field.
Yeah.
There is some more now, more recently, of course, but, it just gives us a backing in which, what we do has this effect, and it's proven, it's scientifically proven to have this effect.
Absolutely. And I think, the way that the osteopathic profession is going now, I think more and more research will come out into these fields. And the type of patients that we're seeing now drive a lot of that research, and that's the key. So we live in a massively stressful modern world. We see tons of wellness blogs expressing those statements. So the byproduct of that is often patients presenting to clinics with with musculoskeletal problems, but beyond that, there's far more relevant things that perhaps need addressing. And by addressing those factors, perhaps we could have a more positive impact on their musculoskeletal health, rather than just, rubbing the sore shoulder, or, pumping the ankle a little bit, or, doing some work into the base of the neck. Don't get me wrong, fantastic and all great, has a good positive impact, but it's understanding that patient as a whole and understanding beyond how that, those basic techniques, beyond how that could be helping, low-level inflammation in the body.
Yeah, and one of the things you said earlier was that you see more research coming into the field. How else do you expect the profession or the field to develop and potentially change over the next 5-10 years?
So I think, again, it's very much patient driven. I think with the patients that we see, I think a lot of the research will go towards the field of functional health and functional medicine. And for those people that perhaps aren't familiar with that, I'd heavily advise people to go in and check out resources online. So the global leader is the Institute for Functional Medicine. Their website's ifm.org, and they've got some fantastic information there in relation to what they do and how they address chronic illness and chronic disease, and the role of physical therapy and movement and exercise in helping. So I'd heavily advise people to perhaps take a look and see what they think, because my feeling is that that's the way that osteopathy can work in line with helping people with chronic disease, and I think we've got a lot to offer as a profession, for sure.
Absolutely. And do you see yourself sort of practicing down that route?
I think so. Yeah. I mean, who knows? 5 years is a long time. So we'll see. But absolutely, I think it's definitely a passion of mine, and I think it's a really important approach, which perhaps hasn't had the kind of press and media that it should have. So osteopathy is. I think a lot of people that I chat to still don't know what osteopathy is, and I kind of have to explain it, or is that the one with the backs? And that's still happening. So the colleges are churning people out still, and great therapists, but the kind of general consensus amongst a lot of the population, I feel, is that there's still a misunderstanding or a misguidance in terms of what osteopathy is and how it can help, for sure.
And why do you think that is? Is that from a education point? Is that from a marketing point?
I think marketing, definitely, for sure. It's, have you got back pain? And you see a lot of posters come up, or you'll see a picture of a spine in the window, or headache or something like this, and it kind of narrows itself down. So people think or associate osteopathy with just the spine. And you and I know that it's that's obviously a very important element of it, but there's so much more to health than just,
Your back.
than the spinal joints, so.
Yeah. So what do you think people can do to help sort of not differentiate themselves, but allow people to, or clients or patients to understand, look, we do a hell of a lot more than just, manipulate your back and HVT your back.
Yeah, so I think, perhaps the colleges have a role to play in this as well, in terms of how they promote and what they offer. Perhaps osteopaths going into educational institutions is a way forward in trying to promote this field and this way of working, or this slightly different approach. I'm not saying it's the right approach; it's just a different approach. It's the way that I see the profession, or the way I would like to work moving forward. So I think moving into different, and not just osteopathic institutions, different, fitness colleges perhaps, or personal training courses, or rehab courses on uni programs. So I think if we can do that, then perhaps we can get a slightly different understanding of what osteopathy is out there to the general public. So,
yeah, and that's huge because everyone knows what a physiotherapist does. Everyone knows roughly what a chiropractor does. But when I tell people I'm an osteopath, I get a little of a puzzled look.
I hear you loud and clear. So
and I work alongside physiotherapists, so they come to me and I'm like, hi, I'm an osteopath, and they kind of think, I don't know what you're gonna do.
Yeah, I mean, how have you found that working in your setting? Have you sort of found that a challenge?
It's been really interesting. So obviously I started prior to lockdown and everything, and I would say I found it challenging to start off with, because there was this differentiation between me being an osteopath versus the whole of the team who are physio-based, who are physiotherapists, sorry. And I had to, adapt to the environment, but still keep those osteopathic core values in place, which is hard when you're being questioned about them a lot, without saying too much. But what I did pick up from them, and this is where I think they do such a great job, is their rehabilitation is at the top of their game.
Yeah.
So
absolutely.
I've learned loads from them, and I've sort of watched them and see how they do things. And, I've been able to ask them questions. And I think as a result, my rehabilitation side, and this is where I think as osteopaths, we might fall back a bit more on that sort of side. If you don't have a rehab background, I suddenly, like I said, I didn't know what I was doing, but because I've been watching them and because I've been learning from them, not just watching from them, I feel like that's definitely improved.
Great. Yeah, I think, working, that's it's just getting in with people who really do understand, perhaps a different approach, and being open to learning from them, and developing a new network or a new way of learning. So rather than sort of narrowing yourself down to one approach or one way of working for 30, 40 years, is the kind of, perhaps try and get a few more tools in the toolbox and understand a different way, and then try and put these tools together in your own approach of working. Because all osteopaths, or most osteopaths, when they come out of the, with their qualification, have a good foundation. And that foundation is there to provide a foundation, and then to then grow upon. So yeah, great.
Yeah,
really, really positive.
Yeah, and then coming back to sort of like CVD, like what kind of books are you reading? What kind of stuff is sort of influencing your work at the moment?
So I'm reading a lot on inflammation, as it happens, and the gut microbiome and dysbiosis, and understanding how the blood-brain barrier and the link between dysbiosis in the gut can impact neurological health and psychological health as well. So I've been to a few conferences, and it's been incredible, some of the information that's been provided in terms of patients that have been quite severely mentally ill, and this is all in the US. So I don't think this has been applied over here yet, but in terms of how looking at micronutrient deficiencies and how they can have a really, really significant impact on mentally ill patients. in terms of their behaviour without having to go down aggressive drug routes. So obviously this is very, very delicate and intricate intervention, but it's really, really fascinating with some of the information that's coming out of the US at the minute in terms of how these deficiencies in micronutrients and can impact inflammation and mental health.
Yeah,
it's really interesting. So yeah, I'm reading a lot of books about about that, and also about my beloved Liverpool Football Club as well. So.
I knew you were going to sneak that in there somewhere.
But you can edit that bit out, Sil.
No, let's keep it in. It's good. It's good. I mean, they didn't win.
We finally won the league after 30 years. So.
I was going to say, did they win or did they not win? I have no idea.
We did. We won.
Well, every underdog, has his day.
Exactly. So goes the saying.
So where can people find you on social media or in practice?
Yeah, so on Instagram, so it's Seb Hicks Osteo. If you can provide a link on my contact details, then people can click on the email and my phone number as well. Website's under construction. It seems an ongoing process, but I'm not a techie, so trying to get this sorted is proving more of a challenge than I expected. But hopefully before long, that will be up and going. Yeah. And I work from practices in central London and northwest London, and also provide home visits. So happy to help.
Yeah, I'll put all your details down in the description box below. But thank you so much for joining me and for helping educate me and maybe other listeners out there on different caveats of osteopathy and gut inflammation and the roles of the lymphatic system that permeate through your practice.
No problem. No, it's happy to be on, and always happy to chat to you, Sil. Always happy.
Great.